Good evening, everyone. My name is Rishi Surana, and I'm a gastrointestinal medical oncologist at Dana-Farber. I'm very sorry I wasn't able to attend this event in person tonight, but I first want to thank Chris for putting on such a wonderful and thoughtful event. Chris, thank you so much from the bottom of my heart. It really does speak to Chris's motivation to help find better therapies for our patients with colorectal cancer. And I can tell you that my research, as well as research more broadly that is conducted at Dana-Farber, is critically dependent on events like this. The funds that are generated at this event will be used to directly fund research that we otherwise could not and would not be able to do. So thank you, Chris. And I also want to extend a thank you to all of you who have participated and contributed, again, to this truly wonderful event. So let me tell you a little bit about some of the work that we're doing at Dana-Farber and how these funds help support our science and clinical medicine. My research in particular is focused on the immune system and cancer. Specifically, how do we get the immune system to become activated, recognize, and kill cancer cells? Cancer cells have a very sneaky ability to hide themselves from the immune system and also actively shut down the immune system. And over the past couple of decades, there's been an explosion of research into immune therapies aimed at activating the immune system to go fight cancer. And these therapies have actually been very successful in many different types of cancers. But unfortunately, they have limited effectiveness in many GI cancers. Colorectal cancer in particular, approximately 95% of patients with metastatic colorectal cancer have shown to not derive benefit from our currently available immune therapies. And part of my work is to try to understand why. Why do 95% of patients with colorectal cancers not benefit from these therapies? The other part of my work is trying to bring next generation immune therapies to our patients by way of clinical trials. And there are two new next generation immune therapies that I'm very excited about that are currently being tested in clinical trials. And these therapies, these two new immune therapies, have shown some evidence of clinical activity in early phase clinical trials. But what they've also shown is that these therapies can also be very toxic, specifically by way of diarrhea and colitis, inflammation of the intestinal tract. So when immune therapies activate the immune system, they activate the immune system to kill the cancer cells, but they can also target our normal cells, specifically the cells lining our intestinal tract, and cause very severe diarrhea and colitis. So the trial that we are trying to get up and running is a very simple trial. It is asking the question, can we use these two next generation immune therapies in combination with another drug called infliximab, which is a drug that we use to treat immune-related diarrhea and colitis? Can we use infliximab to help reduce the toxicity of these two novel immune therapies? And that's important because it can help spare our patients from the toxicities associated with these therapies, but it can also result in our patients staying on these therapies longer. What's also really neat about this clinical trial is that there's a lot of science that we've built into it. The science is trying to understand how these immune therapies work. These immune therapies, particularly in GI cancers, have been around, but the mechanism of action, particularly with these newer generation immune therapies, is really not well understood. And so we built in some very exciting science to help understand how these immune therapies work and what are some of the mechanisms associated with the toxicities, so we can help build the next generation of immune therapies as well. The other type of immune therapy that we're working on right now is something called the cell therapy, which is taking immune cells from a patient's blood, taking them to the lab, engineering them to become active and specific for a patient's cancer cells, and then infusing them back into the patient. And that's a very novel type of immune therapy that is in its early days in GI cancers and something that we're actively working on. So I can tell you that the funds that you've all generated will help us get some of these projects off the ground, specifically these trials investigating novel immune therapies, and hopefully help broaden the effective treatment landscape for our patients. So once again, Chris, thank you from the bottom of my heart for supporting our efforts into developing these novel therapies. And thank you all for your participation in this wonderful event to support our science and clinical medicine. Thank you again.